Second major problem we face is cancer. And all cancer is a group of cells which have uncontrolled growth. They don't differentiate well, and they invade surrounding tissue and spread to other locations. That's called metastasis. It's the second cause of death in the United States. 24% of all deaths in the U.S. are caused by cancer. Remember, we said there were 750,000 deaths due to heart disease every year. Most women in this room are most concerned not about heart disease, but they're concerned about breast cancer. It's a terrifying thought. While only 40,000 women die of breast cancer every year, compared to somewhere in the neighborhood of 300,000 women die of coronary artery disease. It is much more likely, if you do nothing to improve your health, the chances are about 10 times more likely that you'll die of heart disease, lady, than you would get breast cancer. So that, if that's the most likely thing you can get, that's something that you ought to focus on trying to cure. But we're going to talk further about cancer. We have the highest incidence in the United States of breast cancer than all the other nations in the world. U.S. has the highest incidence. Why might that be? Birth control pills, counterfeit hormones, suppress the production of the natural ovarian hormones, particularly progesterone, which has a protective effect against heart disease. 77% of all breast cancers are diagnosed after the age of 50. Men prostate cancer is about 27,000 deaths a year due to prostate cancer. And cancer has 5 broad classes. They're carcinoma. These are malignant cells in the internal organs, the lungs, breast, colon. Sarcomas are in the muscle and the fibrous tissue surrounding the muscle. Lymphomas are in the blood or in the lymph system. Leukemias are in the blood particularly. Adenomas are in the glands, thyroid gland and other glands in our body. We get adenomas. This is a list of deaths, the leading cause of cancer deaths. The most common cause of cancer in America is lung cancer. What do you think that's from? Smoking. So if you can quit smoking, you can dramatically improve, or don't smoke at all, you have your chances of getting lung cancer are slim and none. You may get it, but it's slim and none. You can't get it from secondhand smoke. Then colorectal cancer. By the way, there are 160,000 deaths due to lung cancer. There are approximately 50,000 deaths due to colorectal cancer, 40,000 deaths a year due to breast cancer, pancreatic cancer, 35,000, prostate, 27,000, blood cancer, leukemia, 21,000, lymphomas, 19,000. And it goes down from there. Probabilities of female developing breast cancer over the next 10 years. If you're under 20 years of age, it's about 1 in 2,000 chance of getting breast cancer. By the time you're 30, it's 1 in 230. By the time you're 40, it's 1 in 68. By the time you're 50, its chances are 1 in 37. Lifetime chance of women developing breast cancer is 1 in 8. And this graph simply shows the increasing chances of you developing breast cancer over your lifetime. Interestingly enough, ethnic groups have different incidence of breast cancer. The most likely people to develop breast cancer or have the highest incidence of breast cancer are Caucasians. 133 per 100,000 blacks, 118 per 100,000, Hispanics and Asians, 89 per 100,000. And this probably is due to use of birth control, which is much higher used in the Caucasian population and the higher educated population than in the lower socioeconomics groups. Hispanics tend to have a lot more children than Caucasians do, and children have a protective effect because a woman produces high levels of progesterone during pregnancy, which mature the breast and help prevent breast cancer. What causes cancer? Well, hormonal decline and imbalance. When women get estrogen dominance, that causes, and progesterone deficiency. Estrogen stimulates breast tissue, and you have cancer cells, that's going to stimulate the growth of the cancer cells. Carcinogens in the environment, tobacco smoke, radiation, chemicals in our food, air, and water, infectious agents like viruses, and pharmaceutical drugs. Pharmaceutical drugs, all these are carcinogens which can promote cancer. Why do you think when people take certain drugs, particularly statin drugs, they want to come in and measure your liver enzymes on a frequent basis? Because they have to be the liver has to detoxify and it chews up vitamins, minerals, and nutrients. And there's when people take statin drugs, they get an increased incidence of liver cancer. Weakened immune system. Every one of us makes abnormal cells that are cancerous. Every one of us in this room has them in our body right now. If we have a healthy immune system, the immune system goes in and chews them up and spits them out and gets rid of them. If our immune system is altered or impaired or weakened, then we're not going to be able to get rid of the cancer cells as well. Some people have a genetic predisposition towards cancer. Low thyroid. People with low thyroid have a dramatically increased risk of developing cancer over their lifetime, all types of cancers. And that would have to be due to the low energy level that is produced when people have low thyroid. They have low metabolism, which weakens the immune system, which means they're not going to be able to fight off diseases and viruses and bacteria which may cause cancer. And they're not going to be able to kill off the cancer cells because their immune system is weakened. Vitamin and mineral deficiencies can also lead to cancer.